The Health Department has announced revised COVID-19 regulations, with most of them remaining the same. The department has also extended the period for public comment on draft regulations, which would deal with ailments including COVID-19. That extension is for 3 months until July. Now, under the revised rules, the wearing of face masks indoors and restrictions on gatherings, all of that will remain in place. Let's talk more about this. We're joined by the head of Solidarity's Research Institute, Connie Mulder. Mr. Mulder, a very good afternoon to you. Welcome to the program. So, you've seen these new rules, that they are temporary at this stage until the draft regulations are finalized. Are you at peace with what government has put forward today?
No, I think not at all. The temporary regulations, let's start with a couple of things. The first is procedurally, we think this process has been really a complete failure almost. It just doesn't make any sense that government, in the Gazette that it publishes, admits that they need to extend the deadline to comply with statutory regulations. So this is a deadline on the regulations that they published on the 15th of March. And in the same Gazette, publish the regulations that we still need to comment on, which just makes a spectacle of the whole public comment process, which says they're not really bothering with it. They're just continuing, regardless of what we say. Then regarding the regulations themselves, it is abundantly clear that these regulations were rushed. They do not make sense. Just a couple of examples of we've got face masks that are now applicable to everyone, even though the media release states children in school does not need it. The Gazette itself does not exclude based on age or anything. So where we had regulations that said children under 6 don't need to wear face masks, now suddenly everyone needs to wear face masks, regardless of whether the minister decides. But I think the primary issue we have is the completely arbitrary nature with which, in effect, the Minister of Health can now put the country on lockdown level 1 or not. It's in every regulation there's a stipulation that says the Minister of Health may decide to curb the spread of the disease. Now, this is something that's worrying us. You cannot legislate a disease away. The reason for every single regulation during the state of disaster was not to stop the spread of COVID-19. It was to protect healthcare and make sure healthcare has sufficient capacity to deal with COVID-19. Suddenly, we've got regulations that can be enacted just to stop the spread, which means if there's one case of COVID, the minister can theoretically argue, we now need to stop the spread, and then overnight decide venues go to 50%, everyone needs to wear a face mask. Now, this creates havoc in the economy for several sectors. If you're a concert planner, you're pulling your hair out. How do you sell tickets when you have no idea if you can actually fill the venue or not? So we're quite angry with the way this has been done procedurally. We see it as governance by ambush. Waiting until 11 o'clock at night to suddenly publish regulations is just not the way you're going to restore public trust in government's capability to handle COVID-19. And secondly, there are several things that are substantively wrong, but the thing that worries us the most is the fact that this is once again at an arbitrary level, at national level, the minister basically forever now being able to decide whether the country goes to lockdown or not. And
what say you then, Mr. Mulder, to the argument that as things stand, we've in fact seen in the last week and a half, an uptick in the number of new infections? Yes, I know there's debate about whether or not that's the metric we should be using about where we are with the pandemic and the seriousness of the moment. But when you look at regulations, the bulk of the ones that affected economic activity is restrictions of movement, for example. Stadiums have reopened. People are able to have large gatherings, yes, with a cap. But the argument is that not all of that has been curtailed, and what we have now is merely a precaution to avoid the worst.
Well, I would say, firstly, we always knew COVID-19 was going to be with us. We will see in our lifetimes several waves still. It's a coronavirus. It's not going away, and we need to learn to live with it. We can't go into panic every time there's a lot of COVID cases. The thing that we should be focusing on is healthcare under pressure? And are we going to be in a situation where we were in 2020 and 2021, where people are dying in the hallways of hospitals? And we're not there. We're not there at all. Illnesses have been part of humanity as long as we've existed, and we need to make sure that we've got sufficient capacity to handle it. The reason for the current uptick is just quite simply it's 6 to 8 months after the previous wave, and this is when immunity starts waning due to vaccination or natural immunity. And we're going to be in this cycle for a very long time. We cannot be in a permanent state of disaster almost, which is what these regulations try to enact, just in case COVID-19 flares up. If we are in a situation where we've got a COVID-19 wave and it's clearly that healthcare is going to struggle, then we've got the Disaster Management Act if necessary to enact and say, okay, now we need special regulations for just day-to-day handling of COVID, which is where we will inevitably end. A pandemic ends, it has to become a cyclical endemic illness at some point. For that, we need common sense regulations, and from Solidarity's point of view, the best way to handle it is to make the decision-making as decentralized as possible.
Okay.
Why should the Minister of Health be deciding this? Why not provincial health officials? Why not local health officials who have much more visibility on what the COVID-19 situation is in their municipality?
Government, in an earlier interview with us, at least Dr. Nicholas Crisp from the department was saying, as things stand, the COVID-19 vaccinations are still our best line of defense. Do you agree on that?
Yes, we agree that immunity in the form of either vaccination or infection and recovery is by far the best line. Obviously, vaccination is preferable because you get immunity at a fraction of the cost. Recovery has a high risk, or as a risk associated with it. But we think the focus should be shifting towards immunity, and the department, fascinatingly enough, agrees in the Gazette in some instances and in others not. For international travel, suddenly a positive PCR test, not older than 90 days, is acceptable as well, which shows that you have recovered from COVID-19 and you are now considered immune. But when it comes to gatherings, it just falls away. And what all of this points to is we've got rushed regulations. Government was not prepared for the end of the pandemic, which is actually stunning, given the fact that that's the one thing that we knew would happen, is a pandemic inevitably ends. And they were still caught unprepared. If they had their way, we would still be in a state of disaster until August, at which point they would maybe decide to then, we need to move on somewhere.
So what will you do then?
Yes.
What will you do then? Because various other organizations that don't agree with these regulations are saying they're actually now mulling their options and looking at going to court to challenge them. Will you do the same?
Yes, we've had a consultation with the advocates this morning at 7, and we are going to court to say that this just does not make any sense. This is way too arbitrary. These regulations are way too open for abuse. We're not against the health department making regulations, but from what we can see, this does not fall within the jurisdiction of the Ministry of Health to be able to shut down venues. This is much more a state of disaster situation, with COCTA being the department that should be facilitating this. And we think the Minister has overstepped his bounds. We're of the opinion regulations need to be much more decentralized. Let's have people on the ground make the decisions. And once again, unfortunately, civil society will have to force government into handling the pandemic the correct way.
When do you intend to file papers? And what will you be seeking to get? What will be the remedy that you seek from the courts?
So I've been in trouble before because I superseded the legal team, so I'm not going to go into too much detail. But from what I can tell, they're working around the clock. We're hoping to file papers before the weekend, but it's not a certainty. And with the legal grounds, we're obviously looking procedurally as well as at some of the substantive issues, particularly the absolute arbitrary nature in which we can put the country into lockdown level 1, which we've had, or not, which is not a responsibility that should lie with the Minister of Health. It's not something that should be decided by one person alone in any case. And these regulations make it possible for the Minister to just, if he decides that COVID-19 is going to spread, suddenly plunge us back into lockdown, wreak havoc on the economy, especially the hospitality sector as well as the entertainment sector. This is just, we shouldn't be here. We're going back in time in the handling of the pandemic. We should make common sense regulations for the situation we're in now.
Connie Mulder, good to have your time. Thank you so much.